Hi, my name's Catherine Paul, and I will be talking about what exactly weighted vests, weighted blankets, and lap buddies are, and their uses for your child throughout the day. So, the purpose of these are to increase attention, promote on-task behavior, promote sleep, increase play, and leisure. So, these can help reduce arousal and hyperactivity, along with helping the child control their emotions and to improve the quality and duration of their sleep. Some diagnoses that these devices may be beneficial to include ADHD, or Attention Deficit Hyperactivity Disorder, ASD, Autism Spectrum Disorder, PDD, Pervasive Developmental Disorder, and sensory processing disorder. Some considerations to have is that the vest, weighted blanket, or lap buddy should not exceed 10% of the child's weight. It should be just at that 10% mark for each child. So these will need to be changed as the child grows and develops. These should not be used for infants and toddlers. And the vest especially should be snug but not restricting. So you want the vest to fall on the child and fit well, not exceed the 10% of that child's body weight, and also be nice and snug so that the child can feel that hug that the vest is providing, but they're still able to move and perform tasks. And most importantly, we know that children grow very rapidly, so we do not want to restrict any growth or development or have any safety risks for that child. And finally, when to use these. So as I've mentioned, there are several uses for these and reasons to use them, and so that goes along with different occupations at different times throughout the day. So most importantly, you can use these 2 to 3 times per day for about 15 minutes. So not to say you can't go over the 15 minutes or it has to be on for the 15 minutes, but the sweet spot is 15 minutes. And of course you don't want to just keep these on all the time because that won't be helpful and the child will get used to it and it can be a safety concern. So this can be timed around daily tasks. So if you're going to help with sleep promotion, maybe put the blanket onto the child before they go to bed, maybe while you're reading a nighttime story or singing a bedtime song. And then also during tasks, so they might wear their vest or their lap buddy during an on-task activity, maybe during their homework, maybe to kind of settle them down to get focused on the task at hand. And this can be very beneficial to several children. Again, make sure you keep tabs on how big the child is getting and how small the vest may be. You definitely don't want any safety concerns. So, I believe Kate will be talking to you next about examples of intervention.